Welcome to a presentation on child development, resilience, and the environment. This presentation was developed by Dr. Mark Miller with assistance from Dr. Vicki Leonard, Brian Tenza, Steve Burdick, and Christy Zajac. We want to thank the additional reviewers and contributors listed here. We have drawn heavily from the great work of the Harvard Center on the Developing Child and the Frameworks Institute. We would also like to acknowledge the Frameworks Institute for the ideas included from their publication, The Resilience Scale, using metaphors to communicate developmental perspective on resilience. There are many complex interactions that affect health that we will discuss using an ecological framework. Environmental exposures and social experiences, particularly during early life, contribute to resilient outcomes. Critical time windows during development may enhance social stressors and chemical exposures that can have profound effects on an individual. We will examine how resilience can play a part in mitigating these adverse health effects. In addition, we will discuss environmental justice and how it addresses systematic disparities in exposures to environmental hazards based on race, ethnicity, or socioeconomic or societal standings that may impact people's health. In an age of widespread and increasingly common chronic, multifactorial diseases, a new way of thinking about how factors interact over a lifetime has emerged. The ecological framework for health incorporates the complex interactions and the many events that influence health or disease in an individual or community over time, including those that occur on molecular, cellular, and organ system levels. Scientific discoveries in recent years have refined our understanding of how one's environment can alter the expression of genetic code through epigenetic alterations, changes in molecular signaling, and programming of physiological systems. All these changes have a profound impact on an individual's health. Many external environmental factors influence an individual's health. These include interactions among family, social support systems, and the larger community. Having access to good nutrition, healthy homes, and positive work and play environments are also important in helping to foster positive development. During human development, there are critical times or windows when we are especially sensitive to exposures or interventions that may have a lifelong impact on health. For example, poor nutrition during pregnancy and subsequent low birth weight have been found to contribute to an increased risk for metabolic syndrome, insulin resistance, and cardiovascular disease in middle age. Rarely is one specific factor responsible for health or disease. Instead, many factors interact across different realms and create feedback loops, at times accentuating the impacts. Viewing the causes of health and disease through this ecological approach can help us recognize the conditions out of which diseases in individuals and patterns of disease in populations emerge. It can provide insights in how to most effectively promote health and prevent disease. And it can identify key leverage points where efforts will be most effective. Evidence from the medical and scientific literature points to early exposures in both physical and social environments that can significantly affect long-term health. There is even evidence that if certain exposures occur during critical windows of development, they can disrupt normal development and have greater consequences. Environmental determinants that can have a harmful influence on lifelong health include chemicals and poor nutrition. Social and economic stressors, such as inadequate access to health care and experiences of racism, abuse, or violence, can also have a negative impact on health over a lifespan. There are also positive factors that can increase one's personal health and wellness, such as good nutrition, a nurturing home environment, and high levels of social support. Beginning with conception and continuing through the first years of life, rapid growth and differentiation occurs, and many key processes are programmed. Because essential development may be altered during these brief periods, they're referred to as critical windows of development. Critical windows of vulnerability and windows of opportunity can be thought of as two sides of the same coin. A window of vulnerability is a time during which the fetus, infant, or child is especially susceptible to particular environmental chemical exposures, general environmental deprivation, suboptimal nutrition, or psychosocial stress. Time windows of vulnerability can be relatively long and extend throughout fetal and infant development, or they can be relatively short and precise. For example, thalidomide is associated with developing severe limb abnormalities if exposure occurs 20 to 36 days after conception, and with increased risk of developing autism in those exposed 20 to 24 days after conception. Alternatively, fetal alcohol syndrome may result from exposure during different periods of gestation. The manifestations of this syndrome vary considerably, depending on the timing and intensity of exposure. A window of opportunity is a related concept. It is when structural or functional developmental processes can be maximized by an enriched environment, improved nutrition, or avoiding hazardous exposures and other sources of excessive stress. Since many functions continue to develop through childhood and remain plastic for prolonged periods, this provides an opportunity for external influences to at least partially remediate the potential impacts of early exposures. Even before conception, environmental influences can affect future children. Studies have identified environmental endocrine-disrupting chemicals in pre-pregnancy follicular fluid. One example is polychlorinated biphenyls, or PCBs. They were banned in the U.S. in the 1970s, but we are still being exposed to them. PCBs have been associated with failed implantation in vitro fertilization patients and with reduced fecundity in the general population. Levels of these chemicals in blood correspond with the levels in follicular fluid. Higher maternal blood levels of PCBs during pregnancy are associated with impairment of neurocognitive development in offspring. In contrast, there is evidence that some exposures have a protective influence. For example, having adequate folate in the diet or as supplements prior to conception or very early in pregnancy is associated with reduced risk for autism and childhood leukemia. This is an example of a window of opportunity where an intervention may potentially reduce risks. There is an increasing amount of evidence showing that the health of both the developing fetus and the child after birth can be impacted not only by maternal exposures, but by paternal exposures as well. One example from the literature is that smoking by the father during the time before or around conception is associated with an increased risk of the child developing childhood leukemia. Maternal nutrition and health behaviors, as well as factors beyond the mother's control, are well known to have significant impacts on a developing fetus. Disturbances in the development of the brain and other organ systems in utero can lead to structural and functional changes, effects that are not observed in adults. An inadequate level of folic acid in the diet early in pregnancy has been associated with an increased risk for neurotube defects, autism, and childhood leukemia in offspring. Prenatal exposure to environmental chemicals such as organophosphate pesticides, secondhand smoke, and air pollution has been associated with negative neurocognitive impacts. The brain is developing rapidly in utero and during early childhood. In fact, the brain is not fully mature until executive functions are completely intact in the mid-20s. A well-documented environmental agent which causes disruption of neurological development is lead. Lead exposure can disrupt key processes required for normal brain development. Early life lead exposure results in neurocognitive and behavioral impacts that are different, more profound, and occur at lower doses compared with those found in adults. Rodents exposed to lead during early life have decreased cognitive performance and decreased hippocampal NMDA receptor activity. These effects are similar to the effects seen following maternal stress. Rodents who were exposed to lead but raised in an enriched and more social environment had normal performance and NMDA receptor activity that returned to levels similar to those not exposed to lead. Chemicals can precipitate similar outcomes as stress via the same mechanisms. This experiment demonstrates both windows of vulnerability and opportunity. Children eat, drink, and breathe more per kilogram of body weight than adults. They also exhibit behaviors such as putting hands and toys in their mouths, putting them at risk for higher exposure to substances in the environment. In addition, during periods of rapid growth and development in early life, developing structures and physiological functions are uniquely susceptible to disruption. Multiple influences can interact to magnify risk. For example, children who experience violence along with exposure to air pollution are at increased risk for developing asthma compared with those children exposed to only one of these factors. During the transition from childhood to adolescence, reproductive organs are undergoing proliferation and rapid cellular development, resulting in the potential for disruption. For example, radiation exposures in females during adolescence, a time of particular vulnerability due to immature breast tissue undergoing rapid proliferation, has been associated with a dramatic increase in the risk of developing breast cancer later in life. The risk of developing breast cancer is much greater for adolescents aged 10 to 16 exposed to truncal radiation compared to those treated under 10 years of age when breast tissue is relatively insensitive to the effects of radiation. It turns out that a number of factors are protective. That is, they reduce the likelihood of harmful effects from environmental exposures and foster resilience. The model of a mobile with a fulcrum can help us envision how multiple factors interact to shape children's lives. This model also illustrates how positive outcomes can occur despite the presence of risk factors. Resilience can be thought of as a child developing well and being healthy despite negative exposures. Environmental influences can affect health. Using this model, one can see how piling up multiple risk factors can be dangerous for a child. It is the cumulative weight that balances the fulcrum, resulting in a negative or positive outcome for a child. Violence, poor nutrition, exposure to racism, and other stress-inducing factors contribute to negative outcomes. Similarly, chemical exposures during early life can contribute to these same outcomes, and for some exposures, such as lead, by some of these same physiological mechanisms as stress. For example, exposure to violence combined with exposure to air pollution results in a synergistic impact on childhood asthma. Supportive relationships, community resources, quality education, and similar factors can contribute to positive outcomes. All factors do not weigh the same, so you can't just add the number of positive and negative factors to determine the result. However, when the positive influences outweigh the negative, the child is likely to do much better and vice versa. Children have different genetic starting points and sensitivities to different experiences. It's critical that children have supportive and enriching experiences and avoid environmental hazards. The starting position of the fulcrum shapes how any given fulcrum responds to weight. Children are born with a fulcrum point in a certain place, and its early position matters a great deal. However, the set point can shift over time as a result of early life experiences and chemical exposures. During critical windows of development, the fulcrum is especially shiftable. The starting position of the fulcrum influences how much positive weight it takes to tip the fulcrum toward positive outcomes and how much negative weight it takes to send the fulcrum tipping down toward negative outcomes. Adverse childhood experiences, such as neglect or abuse, or chemical exposures, such as lead poisoning and other forms of pollution, can rewire the brain, moving the fulcrum, and thus the balance, toward favoring negative outcomes. Similarly, as the fulcrum moves to the right in this illustration, it takes less weight on the positive outcome side to counter the weight of negative factors. Many people think of positive outcomes as resulting only from innate drive and personal willpower. This model with the fulcrum helps us understand how important the role of family, community, and the environment can be in shaping outcomes. Research shows that resilience is shaped by powerful genetic, social, and physical environmental factors that are not easily overcome. This model can also lead to the realization that resilience has limits. While there are cases in which positive outcomes occur in the face of significant adversity, there are limits to this equation. Resilient is not synonymous with invincible. The model also points out that interventions focused on windows of vulnerability can be especially effective at moving the fulcrum and changing the role of negative factors in a child's life. Community programs and effective policies have the power to alter the balance of the fulcrum over time. Adding positive factors, such as providing safe environments conducive to good health and learning, can add a counterbalance to the negative ones. Positive elements include teaching coping skills, ensuring good physical health and nutrition, and limiting exposure to negative influences. More support for effective social service, education, health care, and environmental health programs are needed for children, families, and communities who are very sensitive to their environment or who are experiencing many negative factors. They will need the most positive influences to help counterbalance the negatives. The earlier we start trying to move that fulcrum, the easier it will be to move in a positive direction. The neurobiological underpinnings of resilience and vulnerability are deeply impacted by our responses to stress. Let's look at 3 different levels of stress. Keep in mind that not all stress is detrimental to health. In fact, positive stress is a response to a mildly stressful situation that's healthy and gives one a feeling of fulfillment or other positive feelings. Consider the exhilarating feeling when mastering a new challenge, such as a physical sport or solving a puzzle. When one is able to respond to a challenge and achieve a desired outcome, it results in a sense of mastery, control, and elevated self-esteem. Even significant stress may be tolerable and cultivate positive outcomes when balanced with social and emotional support. However, what is tolerable to one child may be intolerable to another who has a high sensitivity to stress. What happens when we have too many negative factors piling up and there aren't enough positive factors to counterbalance them? Stress and adversity can become toxic, particularly if it is severe, chronic, or occurs during certain windows of vulnerability. It can even have a negative effect on brain architecture and impact the health and well-being of a child across the lifespan. Physical exercise, stress reduction practice, and programs that build on executive functioning and self-regulation techniques can improve one's ability to cope, adapt, and prevent adversity at any age. Toxic stress is linked to developmental delays, learning disabilities, and childhood behavior problems, as well as diabetes, heart disease, depression, drug abuse, alcoholism, and other major health problems over a lifetime. The Adverse Childhood Experiences study was conducted in a middle-class population and clarified these associations with early life stressors. It demonstrated that poverty and low socioeconomic status are not the only important sources of early life stressors. Note that this does not only apply to brain development. Other organ systems can be affected due to an accumulation of negative factors. Major stressors such as domestic violence and neighborhood violence have been associated with decreased lung function growth, as well as increased asthma incidence, particularly when these social conditions are combined with exposure to air pollution. As previously mentioned, each developing organ system may have its own critical windows for development. Low-income and communities of color in the U.S. have historically experienced adverse health effects resulting from an environment with disproportionately higher chemical exposures, and children from these communities often suffer a greater burden of toxic stress. The modern environmental justice movement emerged in 1982 as a result of protest against the proposed PCB hazardous waste dump in Choco, North Carolina, a predominantly Black, lower-income community. It sparked national attention to the issue of race, class, and toxic exposures. The landmark 1987 publication, Toxic Waste and Race in the United States, a national report on the racial and social economic characteristics of communities of hazardous waste sites, helped catalyze the national movement we know as environmental justice. The movement continues today with neighborhood leaders and activists calling for environmental equity and working with policymakers to improve land use and environmental health. Many are also working to bring healthy food options to areas known as food deserts and create safe neighborhoods that will allow children to increase their physical activity. The state of California has developed Cal EnviroScreen, a science-based method for evaluating multiple pollution levels and toxic sources in a community, while also accounting for the community's vulnerability to pollution. This assessment combines both measures of exposure to pollutants and personal and community or social factors of vulnerability. The Cal EnviroScreen analysis indicates that Hispanic, Latino, and African American children under the age of 12 disproportionately reside in highly burdened and vulnerable communities. The fraction of children living in the most disadvantaged communities is lowest for whites, 1 in 14, followed by Asians, 1 in 8, Native Americans, 1 in 7, and Hispanic, Latino, and African American children, 1 in 3. 75% of the children in California are non-white, but 91% of the children living in California's most disadvantaged communities are non-white. It is clear that, despite the overall environmental improvement seen over the last 3 to 4 decades, the benefits of this improvement have not been equitably distributed across all areas and races. Similar observations have been made in other parts of the country. Supportive relationships, community resources, quality education, and similar factors can contribute to positive outcomes for our children. Community programs and effective policies have the power to change lives. Children deserve safe environments conducive to good health and learning. These environmental elements include teaching coping skills, ensuring good physical health and nutrition, and limiting exposure to negative influences such as certain chemicals and stress. In this course, we have emphasized that in order to be fully successful in providing a healthy foundation for child development, we must address both societal factors and exposures to hazardous chemicals and environments. We need to incorporate into policy what we have learned from scientific studies about what forces positively and negatively impact the health and development of children. Community focus on these aspects and advocacy efforts to encourage policies that protect children and families from hazards can be instrumental in fostering lifelong health, beginning even before conception.
I am Dr. Mark Miller, co-director of the Western States Pediatric Environmental Health Specialty Unit at the University of California, San Francisco. Physicians and nurses often ask me, what can I do in practice to help my patients build resilience? I think that clinicians with so many demands on their time and energy struggle with how they can help on top of everything else they are doing. At its simplest, we already do try to address inequities our patients experience. For example, by providing a medical home or making referrals for early intervention or providing anticipatory guidance to reduce exposures to hazardous chemicals at home and in the community. When we direct families towards early education environments, we are helping to provide important positive influences in children's lives. Some clinicians go further and provide medical guidance for schools and public health programs. Some physicians and nurses will be involved with group well baby sessions that develop support systems and encourage participants to engage with parenting in new ways. All of us deserve credit for what we are doing now, while keeping in mind that the social and chemical environments of children interact and influence health in childhood and throughout life. Clinicians don't work alone, and we can collaborate with our colleagues and develop community resources to improve the future for our children. Please take the time to look at the resource guide available with this program. It has a list of resources that I have found to be valuable. And thank you for allowing us to share this program with you.